Hello guys, welcome back to the channel. It's Unit 12 Part D. We have been completed temporary methods in family planning. Now we will focus on the permanent method in family planning. In this permanent method, we have two types. One is a female sterilization and other is male sterilization. These are the two types. And first, let's see the female sterilization. In female sterilization, we will see what are the methods that are present for a female to undergo permanent family planning methods. And in the female sterilization, we have two types, that is laparoscopy and mini lap. First, laparoscopy. In this performing, first they will inflame, in the sense they will insert the gas into the reproductive system, that is carbon dioxide and nitrous oxide will be inserted, and after inserting a camera will be insertion will be applied. A camera will be inserted inside the reproductive system to see the fallopian tubes condition, how it is present and where the operation should be performed. They will see whether the way is clear or not, or any kind of scar is present or not. After seeing, observing, after visualizing the thing, they will perform the operation. Insertion will be applied, and then there will be a clip will be kept in the fallopian tube. Now they are performing clip method. In previously they used to disconnect this fallopian tube and then they will knot the part. If they disconnect and they put the knot, when the sperm comes this way, it can't cross this way. Even now when the clip is performed, it will block the way the sperm comes and it can't cross this way. That is how the laparoscopy is performed. And this laparoscopy has some kind of following, that after the delivery for 6 weeks, the woman is not allowed to undergo laparoscopy. Apart from this, the woman one who has a heart problem, respiratory system problems, diabetes or hypertension, and the blood level less than 8 mg by dl, at these conditions the woman is not allowed to undergo this laparoscopy. Next, we have mini lap. This is called as mini lap because here the incision is very small, that is around 2.5 to 3 centimeter. Here first the doctor gives the anesthesia or the sedative to the patient. After this small incision will be performed, and by the help of that incision, the blocking of this fallopian tube or the cut of the fallopian tube will be performed. This block will prevent the entry of the sperm. And in this mini lap, it can be performed immediately after the birth. There is no need of waiting like 6 weeks and all. Like laparoscopy, you need not to wait for a long time. Immediately after the birth, the women can undergo mini lap, or immediately after the abortion condition also the women can undergo. The only problem is, even performing of this mini lap, there is a chance that women might get pregnant. That is, in previous days, only 1% in 200 women used to get pregnant, while now 1% per 55 women are getting pregnant. What are the advantage and disadvantage of female sterilization method? This method is very effective, and it will not affect the female ability of having sex, and there is no any side effects. While when it comes to disadvantage, once the operation is performed, it can't be reversed, and the operation pain is seen for many days, and because of the operation there is injury in the internal organs, and there will be lots of bleeding and infection also can be seen. Male sterilization method. In male sterilization method, we have vasodeferens. In vasodeferens, we will prevent the transport of sperm. How it is performed? First, there will be an opening performed in the scrotum. After opening the scrotum, there in each testis a vasodeferens is present. This vasodeferens works as a transport of sperm. So the connection between this vasodeferens will be cut. Like there will be a cut in the vasodeferens, and to each end a knot will be applied. This is how the vasectomy is performed. When there is a cut, then automatically the transport of sperm is stopped, inhibited. And soon after performing, it doesn't work. This method takes months together, almost like 3 months. In the number wise, if you see, almost a person can eject 20 times sperms even after performing this method. After 3 months, this method start to be in an effective manner, and until 15 days the person is asked to wear the T bandage, and he is not asked to lift any weight, no heavy exercise, and nothing should be performed in which way the pressure is applied on his body. And then after 5 to 7 days, the stitchings which is applied will be removed. Let's see what are the advantages and disadvantages of male sterilization method. It's same as the female sterilization method, like it's permanent, it will not affect the ability of having sex, it's very effective and there is no side effect. When you see in disadvantages, once the operation is performed it can't be reversed, and because of the operation there will be a injury and bleeding can be seen, infection also can be seen, and the pain and uncomfortable because of this operation is seen for 2 to 3 days, while when the operation is performed it's not suddenly effective, it takes some days to be effective. These are the advantages and disadvantages of male sterilization method. Role of nurse. This role of nurse is not only applicable for family planning programs, it can be applied to any program that is introduced into the committees like MMR, RCH, Safe Motherhood, in general family welfare program also. So it's like a general nurse's role. Okay. First one, counselor role. See, when a couple come to a committee or come to any program, they will be confused whether what to do, what not to do, whether we should participate in it or not, whether this has any effective method or it is just give us any side effects, or they'll be very frightened, they doesn't have any confidence to come in it. So as a counselor our work is to solve their questions, solve their doubt, give them courage, encourage them to participate in it. And next, administrative level. See, when act is involved, like when a program is introduced into the committee, it will be not just introduced in one level, like it will be introduced in national level, state level, district level, village level. In village level itself they'll be divided into different routes, like this division, east division, west division, like that they will be divided. In each division there will be lots of departments, so either the way you will be performing as a head of any team, so your administrative level should be in a positive way. Next, supervising role. Yeah, that's very important. Supervising role is not just like you have to go and observe them and instruct them, you have to do like this, you have to do like this. It's not like that. Your main work as a supervisor is, if anybody is performing anything wrongly or anything in a unethical way, you need to correct them, you need to teach them how it has to be performed, not just shouting at them. Your vital role is to teach them. And next we have functional role. Functional role is like you are involving in it, like you are having a good IRP with the committee members, good IRP with the person want to come to attend the program. You have to get involved with them and you have to guide them, like this method is best, you can go with this method is best, you can go with it, or you have to work like this. This is what functional role. And next we have educational role. This role is found in everywhere. The main concept of introducing a act or program is to provide education, create awareness about the particular concept. For example, if you are talking about family planning, the main concept is to provide information about family planning, what is family planning, where and all the family planning is available, like which clinic, what is the emergency number to contact those things, is there any side effects or not, how to control the population, how to get rid of the sexually transmitted disease. These are the educational role. Well, when it comes to MMR, how to protect the mother from the death rate, how to protect the mother from the disease rate, how to give a mother care during the antenatal care, this all comes under educational role. Well, next, the role of research. Yeah, when it comes as a role of research, research is not just like finding the medicine or finding the vaccine. This is not just research. Research is like discovering a thing, that is a research. See, when you are performing a committee, when a program is conducted, at that time, for example, you take family planning itself. In family planning, you will be conducting, you will be talking to many couples. When you talk, you will be recording everything, you need to note down everything. At that time, while noting down, you'll get to know how many couples are interested in it and why are they interested in it. Like, for example, the couple from the age to 28 to 35 are actually involved in the family planning. So that census will actually give us a clear notification for which age groups we should concentrate. This is what actually research is. Like we are getting the complete detail about it. And this is also useful for the study purpose also. These are the nurse's role. Questions will be provided at the end of the chapter. Until then, stay tuned. Bye.